Paraphilic disorders are grouped in mental, behavioral or neurodevelopmental disorders. Paraphilic disorders are characterized by persistent and intense patterns of atypical sexual arousal, manifested by sexual thoughts, fantasies, urges, or behaviors, the focus of which involves others whose age or status renders them unwilling or unable to consent and on which the person has acted or by which he or she is markedly distressed. The International Classification of Diseases 11th revision, ICD-11, grouping of paraphilic disorders replaces the ICD-10 grouping of disorders of sexual preference, consistent with contemporary terminology used in research and clinical contexts. The core feature of paraphilic disorders is that they involve sexual arousal patterns that focus on non-consenting others. ICD-11 paraphilic disorders include exhibitionistic disorder, voyeuristic disorder, and pedophilic disorder. Newly introduced categories are coercive sexual sadism disorder, frotteuristic disorder, and other paraphilic disorder involving non-consenting individuals. A new category of other paraphilic disorder involving solitary behavior or consenting individuals is also included, which can be assigned when sexual thoughts, fantasies, urges or behaviors are associated with substantial distress or confer direct risk of injury or death, for example, asphyxophilia. The ICD-11 distinguishes between conditions that are relevant to public health and clinical psychopathology and those that merely reflect private behavior, and for this reason the ICD-10 categories of sadomasochism, fetishism, and fetishistic transvestism have been eliminated. Diagnostic requirements of paraphilic disorders. Paraphilic disorders are characterized by persistent and intense patterns of atypical sexual arousal, manifested by sexual thoughts, fantasies, urges or behaviors, in which the focus of the arousal pattern involves others whose age or status renders them unwilling or unable to consent, for example, prepubescent children, an unsuspecting individual being viewed through a window, an animal. Paraphilic disorders may also involve other atypical sexual arousal patterns if they cause marked distress to the individual or involve significant risk of injury or death. Paraphilic disorders include the following: 60-30 exhibitionistic disorder, 60-31 voyeuristic disorder, 60-32 pedophilic disorder, 60-33 coercive sexual sadism disorder, 60-34 frotteuristic disorder, 60-35 other paraphilic disorder involving non-consenting individuals. In order for the above paraphilic disorders to be diagnosed, the individual must have acted on the arousal pattern or be markedly distressed by it. In addition, the following diagnosis may be assigned to describe persistent and intense patterns of atypical sexual arousal, manifested by sexual thoughts, fantasies, urges or behaviors, that involve consenting adults or solitary behaviors, as long as either: 1. The person is markedly distressed by the nature of the arousal pattern, and the distress is not simply a consequence of rejection or feared rejection of the arousal pattern by others, or 2. The nature of the paraphilic behavior involves significant risk of injury or death, asphyxophilia, or achieving sexual arousal by restriction of breathing. 1. 60-36 other paraphilic disorder involving solitary behavior or consenting individuals. Atypical patterns of sexual arousal that do not involve actions towards others whose age or status renders them unwilling or unable to consent, or that are not associated with marked distress or significant risk of injury or death, are not considered to be paraphilic disorders. Many sexual crimes involve actions or behaviors that are not associated with a sustained underlying paraphilic arousal pattern. Rather, these behaviors may be transient and occur impulsively or opportunistically, or in relation to substance use or intoxication. A diagnosis of a paraphilic disorder should not be assigned in such cases. Paraphilic disorders frequently co-occur with a number of other mental disorders, including mood disorders, anxiety or fear-related disorders, and disorders due to substance use. It is also common for an individual to meet the diagnostic requirements for more than one paraphilic disorder. Paraphilic disorders may be associated with arrest and incarceration or impairment in functioning, for example, at work, in interpersonal relationships, but these are not diagnostic requirements. Paraphilic disorders should not be diagnosed among children and should be diagnosed only with utmost caution among adolescents. Sexual experimentation is typical during adolescence, and sexual acts may occur impulsively or opportunistically rather than representing a recurrent pattern of sexual arousal. General cultural considerations for paraphilic disorders: behavioral norms, thresholds of abnormality, and attitudes and interpretations regarding paraphilic disorders vary across cultures. Accurate assessment requires information about the etiology, function, and consequences of the symptoms across cultural groups. Thanks for watching. Please like and subscribe.